The Cuban Medical Brigade has been providing health services in areas such as family medicine, aesthetics, and general surgery to Guyana for over 44 years. However, in choosing the composition of this new brigade, priority was placed on the handling of the COVID-19 virus, especially in anticipation of the arrival of the Delta variant, the minister said.
We thought it would be best if we can complement it with the new doctors that are coming in from Cuba. And so we have asked them to send us at least 20 intensivists.
Thus far, the presence of the deadly Delta variant has been recorded and has become the dominant strain in over 140 countries around the world, including neighboring Trinidad and Tobago. But while it has been the consistent view of the minister that the Delta variant will eventually invade Guyana's borders, resulting in an upsurge in hospitalizations and deaths, it was divulged that Guyanese, especially those residing in Region 10, remain lackadaisical in accessing the COVID-19 vaccines.
In anticipation of a surge of Delta variant, where you can see a lot of admission coming very quickly, we thought that this would be the best use of our resources and to prioritize having a skill set in the intensive care unit. Again, while we are preparing for such a surge.
Since the commencement of the vaccination drive in February, Region 10 has been behind with a mere 21% of its adult population receiving a first dose of the vaccine to date. Referring to the situation as unfortunate, the minister urged the regional authorities should do more to increase vaccination in that region.
When the Delta variant gets here, unvaccinated people are going to have a much difficult time. And we have the vaccines available, and we really need people to understand that it's necessary to get their vaccines.
Meanwhile, a statistical report on the country's vaccination number revealed that Region 1 is leading the country's vaccination drive with 72.9% of its adult population vaccinated. Ironically, that region was a COVID-19 hotspot not so long ago. At present, 290,779 persons, or 59.7% of the adult population, has received a first dose of the vaccine, while 149,691 persons, or 30.7% of the population, is fully immunized. According to the minister, Monday was one of the best days of vaccination, with 5,505 persons accessing the jab.
I really urge the leadership in these regions to encourage the citizens within their communities to get out and get the vaccine.
In a recent memorandum detailing the updated information for COVID-19 vaccination exemptions, it was revealed by the Chief Medical Officer, Narayan Singh, that patients with an active COVID infection and those with acute cardiac or acute cerebrovascular events should not receive the COVID-19 vaccines until they have recovered. More so, patients who have an underlying blood clotting disorder such as hemophilia, as well as who are receiving chemotherapy or dialysis, should receive clearance from their doctor before taking a COVID-19 vaccine. Individuals who receive a blood transfusion are eligible for the jab 2 weeks after receiving the blood, and breastfeeding mothers who do not wish to be vaccinated can be exempted for a period of 6 months from the date of delivery. Reporting for the HGP Nightly News, Kendell Richmond.